welcome back to my channel. My name is Shiwangi and today I have a very special guest with me on all of your requests. I have Dr. Shravya. She's my dermatologist who's been treating my skin for a while. I think last year December is when I consulted her. It's almost going to be a year this December. And I have all your questions with me, so stick around while I have her here with me. Alright guys, so I have Dr. Shravya with me who has 13 years of experience and has been treating my skin ever since December last year. I remember the first time I met her and it went so smooth. You guys know about my experience already, but what do you have to say about my skin and how it was and where it has reached today?
Hi Shivangi, it's absolutely a pleasure to always meet you. Yes, I think a couple of months back when the first time I met you, you definitely had certain skin concerns and you had oily skin and you had acne prone tendency. Of course now we've come a long way and I see that your skin is super good, super clean, super shining.
Yeah, I get a lot of compliments for that and people keep asking as to what you're doing and all of that, that I'm only using products that my dermat recommends. And yeah, I also wanted you to kind of touch base on that point as to why would you suggest what you suggest to your clients.
Yes. So primarily our over-the-counter products are good when it is probably early age group like up to 2021 and which is a problem-free skin. But as there are certain issues which come on the skin, it has to be significantly treated by pharmacologically suited agents so that they actually work on your skin, because there are certain drugs which work on the skin. There's a certain pH requirement, there are certain anti-acne gels which need to be used. Now you do not get that percentage in an over-the-counter product. That is why they are considered to be safe to be used without your dermatologist's prescription.
Right.
That's the trick there. But here that's exactly where a client or a person must understand when they must consult their dermatologist, because when their OTC products don't help them anymore or when there's a visible concern on the skin, then it's time to see a dermatologist.
Right. And a few weeks ago I asked you guys if you have any questions for my dermatologist, and a lot of people are actually also confused if the dermatologist is anything different from a cosmetologist. So would you also want to emphasize on that and tell them the difference between a cosmetologist and a dermatologist?
Yes. So I'm really glad this topic has come up, because I think the word cosmetology or cosmetologist has been abused, especially in India, because there are certain rules which are lacking in the medical association here. So dermatologist is the one who completes 4.5 years of medical studies, that's MBBS, followed by 1.5 year of rotatory internship, followed by a 2 or a 3 year period of their masters. Now it could be an MD, diploma or a DNB. That's when they are called a dermatologist. So it takes minimum 9 years to reach a point where one can be called a dermatologist. And frankly, dermatologist is also the true trichologist, because they deal with the study of skin, hair and nails. That's why you should reach out to a dermatologist who is board certified. When it comes to a cosmetologist, primarily there's nobody called a cosmetologist. We would probably call ourselves cosmetic dermatologists if we commonly treat aesthetic dermatology and do a lot of procedural dermatology, right? Cosmetology courses are given out by certain institutes or salons where people can probably just be an assistant to the dermatologist, but never treat your patient, your client, or be the right dermatologist. So there's nothing called cosmetology or a cosmetologist. You should always look for a dermatologist.
Wow, that's quite a lot of insight. And now I'm going to ask the questions that the audience have asked, because they definitely have too many questions. One of the very common question is the procedures cost effective? Like, a lot of people want to know if it's expensive or if it's pocket friendly, and why are they paying what they're paying if it's expensive?
Yes. So yes, I understand this is a very common concern, and a lot of people I meet and all of us dermatologists come across. Primarily, yes, our products and our lasers are pretty expensive. The minimum investment into a dermatology center would be 1 crore. So that's when it comes to your lasers. Our products are expensive.
Quite a lot.
Yes, it is. So that's why it's not very easy to establish dermatology clinics. That's point one. Point two is, yes, when any procedure is done, we take in the experience of the doctor, expertise, the amount of time and counseling the client or the patient is going to get from the doctor, and all the counseling which is going to go ahead. So your procedure may stop after a couple of months, but it is this amount of quality time I would spend with you to make you understand, to do this hand holding, to bring you this.
And it takes a lot of time to also
Yes.
convince people, right? I remember
Yes.
initially when I came down here, I was very skeptical if the things would work for me, if it would go in the right direction, or I would just see like 1-2 weeks of good skin and then it would be gone. But thankfully it's good, and of course that's why we are here and doing this. And people also say too many pimples for the first time suggests something. Now, obviously, the age group is not revealed here, but I'm assuming it's going to be between 20 to 28 because that's the audiences that I have. But yeah, what do you have to say for somebody like who has acne for the first time?
So firstly is, if it's a first time breakout, then definitely there would have been a trigger. So probably did you do a facial, did you do a face wax, probably have you started using newer set of creams, are you using those luxury face oils, something has triggered.
Right.
So make sure you understand what has happened in the recent past, cut down on your sugars and dairy, and get a quick dermat appointment to get that sorted, because unless your dermatologist actually sees your skin to understand what would have triggered at that point. But surely if you get your basics right here, I think by the time you get the appointment and you get yourself there, it would get a little better.
And I think it's difficult, right, doctor, to just like, I see a lot of people suggesting products, on internet, like use this and you would have clear skin, use this and trust me, I've been into that phase when like I've tried all of these skincare junkies telling, or the makeup artists telling use this, use that and all of that. And it actually does not help because they don't know your root cause, and very rightly said that you cannot right away suggest something to somebody who has just told us that they have acne for the first time. So definitely you can cut down on your dairy and sugar because that's like minimum that you can do, and I think that's what is suggested to most of the people initially. But to get the proper consultation and for her to also offer any dermat to understand your skin concern, I think you will need to meet them physically and let them touch your skin and feel it and see what it is, right?
And also probably you should go very easy on your skincare. Less is more is my mantra, because I think this is
definitely your mantra.
Because this is where most people go wrong. They want to use lots of things, they use a lot of expensive things, a lot of Instagram products, and then there are too many things happening on the skin, and then I have clients who bring their bags full of products.
Wow.
And literally
so much money just
just like that. So I think just a clean diet and understand what would have triggered, and then quickly see a dermatologist. That would be the first step to your first episode of acne.
Thank you, doctor. We have next question, which is said extremely sensitive skin with acne on face and extreme dry skin all over the body below the face.
Okay, so extremely dry skin because you're not moisturizing since you have acne. That's a very common myth again. So people who are acne prone tend not to moisturize. Now that breaks the skin barrier and there's more acne which can come up. So on the contrary, make sure you moisturize your skin and your body well. Probably use a good thick body butter. So that till by the time your dermatologist sees you, because they need to understand if this has been a genetic skin issue, something which is triggered, or some drugs which have caused dryness of the body skin. And of course, since you start moisturizing well, and then by the time you see your dermatologist, I think your facial acne, the kind of acne you have, you will be given a good prescription to be able to balance that too.
Right. But what do you think, why do you think people don't apply moisturizer when they have acne? Is it like with the oily skin people or with everyone?
So what I have seen in 13 years of my practice is it's a very commonly misunderstood fact that people with acne tend to avoid moisturizing because they think moisturizers trigger. Now, yes, there are certain kind of moisturizers which can cause acne. So you have to look for non-comedogenic ones. So any product you use, whether it's your makeup, your sunscreen, your moisturizers, they must be non-comedogenic. That is, they shouldn't have a tendency to clog your pores and trigger acne. So that fear is what keeps them away from using a moisturizer. And that worsens the acne.
Makes sense. And I think here is to make a note that you're supposed to be using non-comedogenic products, be it your makeup, your SPF, or your moisturizer
Yes.
or your any skincare.
Yes.
Next question. So we have a lot of questions about dark circles. I think this is a very commonly occurred thing in, especially among the girls, because I have most of the questions from the girls.
Yeah.
So one says dark circles, what can be done to get rid of them? They seem genetic. And the other one says that she's been using some product on her dark circles, and she says that her dark circles are elevating because of that. So do you think actually a under eye cream can also worsen your dark circles?
So firstly, when she spoke of genetic,
Yeah.
now see, yes, if the bony structure, some people have a bonier face with less facial fat, and some people have more deeper sockets. Now that is what gives an impression of deeper eyes, and the shadow effect around the eyes is much more. Somebody like you and me, because we have a little bigger eyes, we do not, probably our dark circles won't be that possible, but the ones whose eyes are deep set, so they genetically tend to look darker. One.
Okay.
Second thing is, if there's a habitual rubbing of the eyes, or if they're on a screen for a long time, right, or probably some deficiencies which are triggering this. These are the things which can irritate and cause darkening of the eyes. And like one of your followers mentioned, probably she's used a cream. Yes, if a content of a cream has irritated the eyes, it can cause something like an eczema, irritation, redness, dryness, further leading to darkening. But not as such as darkening of the eyes. But yes, just the existing dark circles seem to have exaggerated because of a irritation from that cream.
Right.
That's a possibility.
You also mentioned about the screen time right now. So I mean, obviously, all of us, you, I, and like the audience, all of it, like people are watching this on the screen right now. So all of us actually use screen a lot. So what do you have to say? Like, what is that one thing that we should be doing while we're using the screen? Because definitely we're supposed to reduce the screen time, but what can help? While even we are on there.
Yeah. So primarily what happens is, when we are watching the screen too much, or somebody's on there as a software engineer who's onto their laptop too long, the blood supply around the eyes decreases. That is what makes the skin much thinner and the veins more visible. That makes the eyes look much darker. Now one of the most important things which I tell my clients is to give those screen breaks. Every 20 minutes get off the screen, probably do some paperwork, move out, don't even get hold of your phone or your laptop, and rest your eyes. One. Second thing, plain glasses. Third thing, even blue glasses help. So any kind of glares or goggles also helps, because this is very important. Yes, professionally, if you are onto the screen, like someone like you or somebody at the software office, they'll have to look for other ways of shielding it, and of course use your sunscreen on the eyelids.
Oh, sunscreen on the
Yes,
eyelids.
yes.
I think sunscreen is like the most misunderstood concept.
Yes.
Like, in India we don't respect using sunscreen enough unless like we are burnt or unless we see something not going right. But ever since I've started using sunscreen, I've seen like the massive change in my body and my skin, and also my like hand and legs texture of the skin. So definitely, if you don't use sunscreen, buy it today, use it.
Yes. Sunscreen must be applied on the eyelids also, because infrared radiation is a major source of tanning for anybody who's on the screen. So please use it even if you're indoors, even if you're just into probably 12 hours or 14 hours of laptop use. You need to use sunscreen on all the exposed areas, even if you're indoors.
Indoors, yeah. Right. Next question is, I've got painful pimples and it hurts really bad. Please help.
Okay. Generally, painful pimples indicate pus. Pustules and the papules.
I've been through that. Like, I'm gonna add a video here where you guys can see that I've had pustules when I came here.
So probably you'll need a course of antibiotic, but then obviously you shouldn't do any of this on your own. I wouldn't recommend self-medication. Never do that. Reach out to a dermatologist, understand which antibiotic would suit you, because all of us have probably had some reactions to any antibiotic. It's common. So your doctor needs to understand what suits you better and then give you a prescription accordingly.
Thank you for that, doctor. One last question. So a lot of people are saying and talking about home remedies, and if they can use flaxseed gel as daily moisturizer, and what kind of home remedies can they use at home is also a lot of people asking.
So again, very commonly I say a very young skin, like somebody up to age of 20, 21, Home remedies is a good option because I think our Indian diaspora, we have it set in our psyche that home remedies are the safest. To some extent they are. So my favorites would be something like probably your besan chickpea, and probably some cucumber on the eyelids. Beyond that, home remedies may not help. But when you're on some kind of treatment, do talk to your doctor what home remedies would suit your skin type at that point. Because after things settle down, let's say for example your acne settles down, I do allow my clients to use certain kind of home remedies, but definitely not the ones which are acidic, like probably dahi or anything which they scrub too much. No, the soothing ones like your besan, I think is a safer bet. But everything depends on what products you use, because we don't want to kind of mismatch the products which you're using at home as well as what your doctor has given, because the pH has to be balanced. So everything needs to be sorted right so that you're able to do your bit at home also.
And you need to understand your skin better first. Like a lot of people wouldn't even know if they have oily skin or they have sensitive skin or they have dry skin. Like most people in general would just say that they have sensitive
skin. Yes.
I
hear this, doctor, my skin is sensitive. So I kind of reassure them that yes, we are here as dermatologists. We know, we are aware, we are taught, we are experienced to treat sensitive skin. So don't worry, you're in safe hands. And there are certain products which temporarily can cause irritation. It's all about how it's applied. Now, of course, your doctor must give you that time and explain to you how to use a certain product, because overusage or incorrect application can irritate. But then again, there's a balance. You can always give it a break and restart, and then your skin will be sorted there.
Right. Okay, we'll take one last question, which is about dark pigmentation around the mouth, around the lips. And I think a lot of people say that they have uneven skin tone, like their around the mouth area is darker when compared to their entire face. So what do you think causes this?
See, a lot of times the darkness around the mouth can be also triggered due to probably some new toothpaste or a new lipstick.
Which can also
the gels can cause. So it can cause a little bit of contact allergy, which causes pigmentation around the mouth. Lip licking, lot of times is very less known. That a lot of adults also have a habit of drooling or probably just mumming their lips in because of dryness instead of using a lip balm. That can cause pigmentation. In case you've recently gained weight, that can also add to pigmentation around the mouth. Or probably your sugar intake has increased, that can cause pigmentation around the mouth. So understand what is your trigger there and get it treated accordingly.
But is there anything that people can avoid to get rid of the mouth pigmentation, or like will they have to go via the procedures and stuff?
So initially, yes, we'll have to understand what the root cause is and then give certain creams, skin lightening agents, but everything depends on the reason, because the different products or different pharmaceutical agents we use depending on the type of pigment it has. So start with your moisturizer and sunscreen. Home remedies wouldn't help. Definitely you will have to reach out to your dermatologist to be able to treat you the best.
I mean, I also feel that we as human beings, we feel that okay, if we use this, it's going to come down. If we use something else, it's going to come down, all that. We actually don't understand the root cause of a problem. Like commonly with me also, it took me so long to reach the right dermat that I could finally land onto you. But then before that, I've had my experiences wherein I was trying to understand my skin, if I have certain kind of undertone, if something is causing me acne, my food habits, what was it? It was so confusing, because you meet different people and they have different opinion on your skin, but nobody actually wants to hear you in the first place, so probably do certain kind of procedures and then you understand something's working for you. That brings me to a question, which is also part of the questions, but I personally want to know that a lot of people feel that the procedures are not safe, and I've had a DM from somebody who said that she's very scared of getting lasered or any kind of those tools on her face, because she and her mom feels that it might cause cancer in the long run or some kind of like skin disease in the long run. And this is, I think, very, very commonly in people that they believe this. What do you have to say about this?
So yes, this is a very common fear a lot of youngsters or middle-aged people do come across. They use the word cancer, which actually has absolutely no connection with all of this. Now, frankly, when any procedure is done, there are certain do's and don'ts to be followed. Every procedure is safe, FDA approved. that is why you must choose the physician properly.
Yeah.
Because it must be an FDA approved equipment, your procedure, your doctor must be following, is supposed to follow certain do's and don'ts in the procedure. None of these procedures are going to cause any form of cancer or long term side effects, because this goes, the wavelength of any laser goes only up to the skin, not even beyond the skin, even if I wish to. And as a disclaimer, yes, all these procedures are safe as long as certain the client is following do's and don'ts. Otherwise they can have slight irritations, they can have redness, they can have itching, burning, some kind of rashes, but they're all transient, temporary, informed to the client.
Yeah.
So they're never going to cause any long term side effects. And to be very frank, most of us, including me, we have done all the procedures, so we know that we are never
Yeah.
going to offer anything to anybody if we are not convinced about it. I think the conviction matters.
Yeah, I agree. And I've had 2 procedures, and I remember you told me that, don't apply this particular cream before
yes.
3 days, right?
Yes,
3
yes.
days or 5 days, and after 2
Yeah.
days also you don't supposed to
Yeah.
apply that. Would you want to like explain them about the procedures that you did to me?
Yeah.
Because after that is when we started seeing the massive results, right?
Yes. So for Shiwangi, we started off with an acne control peel, which was a salicylic gel peel. Salicylic acid, yes, again acid is not acid. These are fruit derived acids. So salicylic gel helps in reducing your oiliness on the skin, acne tendency. It also helps in reducing the blackheads, whiteheads, as well as the bacterial load on the skin. Of course, it gives you a glow. Now this has absolutely no downtime or peeling to say so. Very commonly you would have heard these as chemical peels, but like I repeat again that these are just fruit acids, and they give very good results. Generally 4 to 5 sessions are required depending on the type of skin, and each session is done at a gap of 2 to 3 weeks. So that was the first thing we did. Second thing I think we started off was we did something like a laser toning for her, which helps in reducing the pigmentation or the scars on the skin. Laser toning is popularly also known as a carbon peel. It's a Q switched laser.
Yeah.
Now we apply a medical carbon powder on the skin. All these procedures are done after proper consent, cleansing the skin, degreasing, photographs as a reference, and then we apply the medical carbon powder, we cover the eyes with goggles, and we safely start the laser. It takes about 20 minutes. And the beauty of carbon peel or the laser toning is it helps in reducing acne tendency, oiliness of the skin, mild scarring, lot of pigment reduction is done, and this is the best way to maintain your skin. It's a quick 20-25 minutes procedure. Mild redness post procedure is expected, and all you need to do is come back for a couple of sessions, 6 to 8 sessions, and you're sorted.
And it's painless.
Yes, it's painless,
Yeah.
with just kind of a tingling sensation on the skin, which is very much comfortable, and it's my favorite procedure, my personal go-to favorite.
Yeah, because it helps in like a lot of things that
Yeah.
you just said.
Yes.
Alright, doctor, and I will let you go. Thank you so much for giving time and doing this with us. Anything that you want to leave them with, because it's festive season and we are going to be wearing a lot of makeup and eating a lot of sweets as well.
Yeah.
So is there anything that you can leave them with, like any
Yes.
advice?
Yes, firstly, I think don't miss on your gentle cleanser, don't miss on your moisturizer and sunscreen. I know you'll have to do a little makeup in the evening, so daytime probably let your skin breathe. Use non-comedogenic products, make sure your brushes are clean. However late you come back from your dandiya, please wash your face, cleanse, moisturize and sleep. If you have a night routine, follow it. Shampoo regularly, try and avoid too many hair products. I think these are the basics, you'll do well. And thank you, Shiwangi, it's always a pleasure to meet you.
Thank you so much, doctor.
Thank you.